The City of Johannesburg has launched mass screening for essential workers, and to tell us more about the campaign, I'm joined on the line by the MMC for Group Corporate and Shared Services, Councillor Loyiso Masuku. A very good afternoon to you, Councillor, and thank you for your time this afternoon. Now, just yesterday, we heard of a reported case of COVID-19 at the Union buildings, which then had to be shut down and sanitized. And this once again just reaffirmed the importance of ensuring that workers are screened even within the workplace. Tell us more about your campaign. This started yesterday. You started first with Category A. Who exactly qualifies under that category?
Good afternoon, Tommy, and the listeners at home. Thank you, and the viewers. Thank you very much for having us. Our essential services workers are very important because they are indeed in the front line and are working to make sure that we keep the services going. So what we have done as an employer is to ensure that we categorize our employees. So category A would be the employees who you would regard as the front line. So that would be your general workers, the pick it up employees, who make sure that our waste at home is collected, the JMPD officials who maintain law and order and ensure that enforcement of the law happens, the Ria Vaya buses and the Metro bus that you see on the road, Tommy, those would constitute our essential services, and they are in Category A. And we are starting with them particularly because they are the employees who are in the front line. They interact with the public, and they are exposed on a daily basis. And then you would have Category B. Category B would be those who have been and are still working from home. Those are employees who don't necessarily have to physically be in the office, but continue to assist and ensure that service delivery is not interrupted in the city.
So with regard to Category B, you're saying that they are working from home. At what point will they be screened? Will they be screened while they are still at home before they actually get onto the working premises, or will the screening only happen once they physically resume work on the premises?
So how we're doing this, we're doing it in phases. And the phases that we are doing, Tommy, it is in such a way that we also don't overburden our system of occupational health nurses and our clinics in the city. So in Category B, what we would do, for an example, we are going to start with a third of them, and then when that third starts coming back to work towards the end of May, it will be that particular percentage, then that will be screened and then tested as well. And it works because we have different venues. So we're not doing it only in one central point in the city. So we've got, like in Braamfontein, we've got in Soweto, we've got as well as in Boysens and so forth. Even in Norwood we have. So we've been able to spread it across so that employees can be able to access the facility once we communicate. One of the things that we've realized is critical is the ability to communicate. Because the anxiety is also there. I'm at home and then I'm expected to come back to work maybe the 1st of June as an example. What must happen? So we communicate through our SMS channel. We communicate with our employees through the intranet so that we keep them abreast and they are able to know that this will be their time for them to be able to be screened and tested and come back.
Outside of the screening and testing that you're doing now, have there been any reports of the City of Johannesburg workers, whether perhaps at home, who've tested positive for COVID-19, any that you are aware of?
Yes, we did have one from EMS. It was an employee who had traveled to Germany in March, Tammy. We also did have confirmed cases at City Power, but safe to say that those employees are recovering well and are almost done with their 14-day period. And over and above that, we do as a city provide support to employees who have tested positive. We've got an employee assistance program. So employees, even the family members, if the employee so wishes, we do offer the psychosocial support as well as counseling for them.
Now, won't you take us through once again exactly where the testing locations are going to be?
Okay, we've got one in Boysen. It is one of our wellness clinics in Boysen. We also have one in our main offices. This is in Braamfontein Civic Center. This is where the council chambers are, as well as the operations of the city, as well as where all the councillors operate from. We also have another one in Soweto at the Pick It Up depot, as well as another one, Tammy, in Selby. And you will see that these locations are centrally located for all our essential services worker, including the areas where you will have mainly your JMPD and the areas where you would have workers who are actually at work at this particular time.